Hi, this is Dr. Donald Pelto, and I'd like to thank you for looking at this website about this new ebook that I have for my patients. I'm very excited about this time because an ebook is really the easiest way that I can share information to you about your foot problem. And I put together this book because I get a lot of requests from doctors. Doctors send over patients, and they tend to send the same type of patients over with the same type of problems. And I find that many people have questions they want answered before they come. So in this video, I'm going to go over the two different types of books that you can request by putting your name and your email here, and also what you're going to be finding inside of the books in terms of the content. First, I'd like to explain why I'm using an ebook. An ebook is an electronic book. It's usually in a PDF format or some other type of format that's easy to open up. And the main reason I did that is because this first book, there's really two books. There's one book on diabetes, and there's other one on foot problems. Okay? The book that's on foot problems is color, and it's about 69 pages long, maybe a little bit more. The one on the diabetes is actually about 22 pages long. If I were to print these out and give these to all my patients or even all the doctors, it would be very expensive. But I can provide this to you for free. And more importantly, if you have a friend with a foot problem, you can pass it on to them. It's very easy to get one. It's in a digital format. You can email it very, very easily. Now I have a certain amount printed out of the diabetes book that I use because it's a lot less. It's 22 pages. The foot problem book, I only gave one to different primary care doctors or your general physicians so that they can have it as a reference guide. But let's get really into the meat of it. What are you going to find inside of these books? First, let's start with the diabetes book. Now, even if you don't have diabetes, I'm going to cover the diabetes and then the general foot problems. First, with the diabetes book, what you're going to find a healthcare guide to diabetes in your feet. You're going to learn what some of the common mistakes are that people make when they have diabetes. And the problem with these mistakes is they can lead to the dreaded problem of an amputation. That's what I try to do. I try to give you this information when you have diabetes so that you can prevent a problem, so that you can prevent that amputation from happening. It's going to cover a few different types of topics. It's going to cover your blood flow to see how the actual circulation is on your feet. Also, it's going to cover neuropathy. Neuropathy is a problem where your nerves tend to become deadened and numbness or tingling in your feet. It's going to go over as well something about diabetic shoes, who can really qualify for the shoes. And then most importantly, which you're probably wondering, is how you can prevent a foot wound or an ulceration. Just a quick tip, a wound usually begins with some type of a callus or a blister. So if you can prevent the blisters, you can prevent the amputations. And we're going to go over and discuss about how to prevent an ulcer on your foot. That's the diabetes book. You can request that. Now, the other book that I'm going to be offering is a foot book. It's a general foot problem, how to heal your foot problems quickly. And the way I got the topics for this book is that I looked at what doctors were sending me. What are the most common patients that they were sending over? And I wanted to provide this resource for their patients. Or if you have a foot problem, or you've had this foot problem, I'll give it to you so that you can pass it on to your friends so they can get information. Really the way this book is aligned, it has about 10 or 11 different topics. It has what the cause of the problem is, what causes it, explains also what it's caused from, how you can diagnose the problem, what steps, do you need an x-ray, can you feel in a certain location, and then most importantly, what you can do at home before you come and see me, what you can do when you see me, and then when surgery is needed. And as well, there's a little portion of some frequently asked questions. So what are the topics that we're going to learn in that book? Well, the first one is one of the most common ones that I see these days. It's called heel pain. Heel pain or plantar fasciitis. That's a problem in the bottom of your heel when you push down, or when you get up in the morning you have pain and you're limping. It gets a little bit better, but then when you sit down again it hurts. Very, very common problem. Go over all the different types of treatments for you with that. The next treatment, ingrown toenails. So ingrown toenails are where the side of your nail gets kind of ingrown there, may become red, may become infected, how we trim it out, how you can treat it after, and more importantly, how you can prevent it. We're going to go over That's a very, very common problem that I see with people. A lot of people think that heel pain and ingrown toenails is something that you just have to live with. Really, if you have foot pain, you shouldn't be living with it. There is a way of treating it. The next thing I'm going to talk about is something called a neuroma. A neuroma is usually found within the third inner space on your foot, and if you push on it, it tends to have a clicking sound or a painful shooting, zinging pain to the third and fourth toes. It hurts a little bit more when you have shoes on because it presses the nerve. What a neuroma is a pinched nerve between the foot, and I'm going to explain a little bit what causes that as well. I'm also going to go over warts. Warts are very common. Warts typically are found in younger kids, and it can be very, very difficult to treat them because they tend to be very slow to recover, and they can take a long time. I'm going to go over the different types of treatments. Just as an aside, what we do in the office normally is a laser treatment. The way the laser treatment works is that you have your skin, you have the wart that's in the skin, but you also have some blood vessels going to it. What the laser does, it has a laser beam that pins down, and it actually coagulates all the blood flow, and it creates a little bit of kind of like a blood blister there. And that blood blister can then lift it out along with the wart. That's how the laser treatment works. Another area that we're going to talk about in the book is flat feet. Many adults come in because of flat feet because they have pain. That could normally be due to the posterior tibial tendon. But a lot of the kids can come in with their parents, and the parents want to know, well, when do I need to have surgery? When do I need to have orthotics? What are orthotics? And I'm going to explain what you can do for those types of problems as well. Another very common problem that I see is called athlete's foot, or dry, damp skin in the bottom of the foot or between the toes. Very, very common foot problem. I'm going to go over some of the home treatments that you can do before you even come and see me. And then the last topic, it's kind of overlapping with this one, is with diabetes and also wounds, because a lot of doctors send patients over with diabetes and different types of wound problems. And that can segue into the second book as well. The reason I have this as a separate book is because it's so common and it's so prevalent. I see people every day, and everyone that has diabetes should see a foot doctor at least once a year, if not more frequently, depending on what type of risk factors you have. Now, if you have just a general foot problem, usually we can treat it in a session or two. But the reason I want you to get this book is because there's a lot of home treatments that you can do. Because I know that if you look online, there's a lot of information and there's a lot of resources, but a lot of times they can be confusing and you're not sure which ones to trust. You're not sure what you should do. And this book is a great way for you to start learning about it. And feel free, if you have the document, pass it on to your friends. It's a great resource for you. And if you want to learn more information about the office and about how you can treat your foot problem, or even where to get this, because maybe you're watching this and you haven't got it from someone else, you can simply go to my website, which is www.drpelto.com. And on the drpelto.com website, you can find a free ebook link. Click the link and you can request one or both of these links for you. Okay, well, hope you enjoy.